They're physical, emotional and cognitive symptoms and signs that indicated of the fear of intimacy. The physical symptoms include muscle pain, stomach or gastronomical distress and nausea, sweating, increased heart rate, shaking, trembling at the mere thought of getting intimate with someone. Often these signs are mistaken for some other illness. They are actually the body's way of preparing itself for a fight or flight response to intimacy. So if we look at the chakras as well, that's why some of us, a lot of healers, because they want to help people, they have a protruding stomach or protruding belly area. So this is actually very much, and this actually happens to a lot of people, that they're longing to be with someone, that longing of connection, but their fear of intimacy also makes it difficult. So that means then they have a complex of loving themselves, the connection to themselves, which is the solar plexus. So the other thing as well we look at is often these full-blown anxiety and panic attacks are also likely in the person suffering from the fear of intimacy. They're likely to feel scared and confused as it's unable to distinguish between reality and delusion. The phobia associates the feeling of vulnerability as they experienced in the past of weaknesses and inferiority, and tries to either control people or avoid them completely. So this is where sometimes where we think of a narcissist, where I've talked about narcissists, psychopaths and sociopaths recently in a talk, in a video, and this is where actually people don't understand that. It's where sometimes narcissists can actually become, why they become controlling, want to control every situation. So it's a sociopath is because they've had parts where they didn't have that control and it made them vulnerable or upset or made them feel like failures. So then they become these issues. It does happen quite a lot and it's quite common. So the treatment of the fear of phobia, well, there's a few things. So first of all, self-help is the best known treatment for overcoming, and this is becoming aware of the fear is the first step in the feeling process. So experts recommending making a list and writing down thoughts about the events that may trigger the actual symptoms. And this is why hypnotherapy works for that, because it goes into the subconscious to find out what is the trigger and reframing it to make someone have a better life, better peace of mind, and having less of the fear of intimacy. Patients must write down their subjective assumptions along with their beliefs, judgments and predictions. Judgments and beliefs are probably one of the biggest issues with fear of intimacy. Their belief that if they do these things or so forth. And then also religious persecution was a huge thing for many years. It's not so much now, but it was for many years. This can help the individual look for subjective evidence of their fear-provoking faults. Patients must also write down answers to the following questions. What is the worst that can happen when I get intimate? What good might come out of the situation? And how tolerable would the consequences be? These questions can help one confront the situation in a step-by-step manner. Deep breathing, pranayama and breath work, and conscious stopping of negative thoughts can also help one overcome fear of intimacy. Apart from these, there are other treatments such as CBT, cognitive behaviour therapy, these are all part of hypnotherapy as well, general counselling and psychotherapy. Group therapy as well as is quite common as well if people have intimacy within a relationship. Sometimes people have an fear of intimacy after they've been pregnant or after they've got married because of judgments in family and so forth. And some people also use pharmaceutical things to overcome the fear of intimacy phobia. However, the fear of intimacy is also, as this was mentioned recently with someone like Lily Allen, who she said that when she used to have relationships, she used to never had a relationship with someone because she was always drunk. She was always fearing of things going wrong. So again, we have to also look at this in a bigger context. So the other thing is, in conclusion, fear of intimacy can deeply affect the quality of someone's life and impact their day-to-day functioning. If your fear of intimacy is causing you distress or depression, this is where I can come in as a therapist and help you, and don't hesitate to help for it. Is in a consultation we can find out where this fear of intimacy comes from, why you have a fear of intimacy, and then where we would go with that. Now, mostly with fear of intimacy is linked to the fear of love, and then obviously the fear of commitment. It depends on which situation you're in. If it's causing the fear of intimacy, is causing you worrying about dating, that can be an issue. If the fear of intimacy is to do with family, but there's also been a previous family issue, what's happened of abuse, or the idea of over-affectionate, and sometimes people don't like that. It can also cause them to feel very uncomfortable. These are issues we can work with as I work with as a hypnotherapist on quite not a daily but quite regular occurrence. So again, if you are interested, please message me on any of the social media platforms this video is on. and I'm quite happy to help. Also, if you do message me or do a comment on a YouTube video, LinkedIn, whatever, I will send you my contact details, and you're more than happy to have a free consultation, and we can speak about it and get you on your way to removing this fear of intimacy. So until then, and my next video will be the fear of commitment, which will kind of make up the trio of this fear of love and fear of intimacy and fear of commitment as like a trio of issues which are all interlinked. So until then.